Welcome to the deep dive. It's funny how sometimes the most critical health advice, stuff we know works for chronic diseases,
Mm.
doesn't seem to stick.
It's a real head scratcher sometimes, isn't it?
Totally. And today, we're diving into a big one. Smoking cessation support for people with asthma and COPD. It's crucial, but often overlooked.
Yeah.
We're drawing on this recent study, Karadoğan et al., from Tobacco Induced Diseases. They looked at what's actually happening on the ground in Turkey.
Right. And our mission really is to try and figure out why. Why does this vital support, which we know helps people with these airway diseases, often just fall by the wayside?
Exactly.
We need to look at, how many people are still smoking and what's stopping them from getting help to quit.
Okay, so let's jump into the findings. We all know smoking is a huge risk factor, right? And it makes managing asthma and COPD way harder.
Absolutely. A massive complication.
But here's the thing, the study highlights, even after getting diagnosed, a lot of people keep smoking. It was 18.8% of asthmatics and, wow, 34.5% of COPD patients.
Those numbers are pretty stark. And it's critical to understand why quitting is so important here. I mean, for COPD, stopping smoking is, it's the single most effective thing you can do to live longer, period.
Right.
And for both conditions, smoking just messes with how well treatments work. Your inhaler, it's not going to be nearly as effective if you're still smoking.
So the medicine isn't working properly.
Exactly. Leading to more symptoms, maybe even using more medication, but not actually getting better, kind of undermines the whole treatment plan.
Okay, but here's where it gets really concerning. The study looked at uptake of support. So patients were told about help, like quitlines and clinics,
Standard advice. Yeah.
but almost no one used them. After a month, get this, 85.1% of smokers with asthma hadn't even tried to call a quitline.
85%.
And for COPD patients, only 1.9%, or less than 2%, had visited a cessation clinic.
That's incredibly low. So what kind of support are we talking about? Usually it's a brief chat based on the 5A's model: ask, advise, assess, assist, arrange.
Right, I've heard of that.
And then referral to clinics, maybe with counseling. Sometimes free medication is available too.
So the help exists, theoretically.
It exists, but those numbers suggest huge barriers. Maybe people just don't know the clinics are there. Or, practical things, transport, cost, time off work.
Yeah, the real-world hurdles. It's that classic gap between knowing and doing, isn't it?
Definitely. And maybe the consequences don't feel immediate enough somehow.
So the study also looked at who is still smoking. This was interesting. For both asthma and COPD patients, being younger, under 65, meant you were more likely to be a current smoker.
Okay. Younger patients.
But having the disease for longer, that was linked to being less likely to smoke.
Which sort of makes sense. Maybe the severity hits home over time.
Perhaps. And for asthmatics, not having a family history of lung disease was linked to smoking, weirdly. While for COPD, not having been hospitalized before was linked to current smoking.
Those are interesting patterns. It really points towards the idea of teachable moments,
Teachable moment.
Yeah, like maybe people keep smoking early on because they don't fully grasp how serious a disease is yet. Or maybe they haven't had that scary hospital visit.
Right, it hasn't felt real enough yet.
Exactly. Which tells us that just giving medication isn't enough. We, healthcare providers, need to be really clear. This treatment won't work properly if you keep smoking. It's not just better if you quit. It's this medicine needs you to quit to do its job.
That's a crucial distinction. So bringing it all together then, this study really shows a big disconnect, doesn't
The
it?
siege gap. Yeah.
The support is there, it's recognized as essential, but in the real world, for asthma and COPD patients, it's just not being used effectively.
Right. And the core message here has to be, quitting smoking isn't just a nice to have for these patients. It's absolutely fundamental.
This is the foundation for everything else working.
Precisely. Better treatment outcomes, better quality of life.
Yeah.
It starts there.
So here's the final thought for you listening. If even getting diagnosed with a serious lung condition like asthma or COPD isn't enough to consistently push people towards using the help available to quit smoking, what are we missing? What new approaches, or maybe what deeper understanding of what motivates patients do we need to actually bridge this gap and make sure this vital support gets used?
That's the big question, isn't it? How do we really connect people with the help they need?